Mallet finger injuries. Safely removing, cleaning, and get the splint back on. A mallet injury means that the tendon that lifts the fingertip into a straight position has been injured. The result is a drooping fingertip, called a mallet deformity. You have been fitted with a splint to hold your fingertip straight while the tendon heals. Your splint needs to be on 24 hours a day, usually for at least 6 weeks. But what should you do when the splint gets wet? Step 1. Safely remove your splint. When you are taking off your splint, never lift your fingertip off the table. Make sure you do this by keeping pressure on the pad of your fingertip, ensuring the joint at the end of your finger does not bend. Keep the pressure on the tip of your finger as you slide the splint off. Step 2. Wash and dry your finger and splint. If possible, get someone else to wash and dry the splint for you. If you need to do this yourself, focus on keeping the pressure on your fingertip and use a towel or tissue to dry the splint and your finger well. Step 3. Safely get the splint back on. This is the part where you need to be most careful not to let your fingertip bend. Keep your hand pressed on the table and carefully slide the splint onto the injured finger. It may help to reach through the splint to keep the tip of the finger from bending under. Tighten the strap so the splint is secure. Your local hand therapist can adjust your splint if it is not fitting well, and can troubleshoot any other concerns you may have.